Hello, friends. Yes, you are very familiar with this. I am about to perform another leg aesthetic operation. You know, this is one of the surgeries we frequently perform. However, while I am doing this leg aesthetic surgery, I will not explain this surgery to you anymore. What will I share with you? I will explain the process of ankle thinning. Or should I talk about slimming legs today, dear friends? Fill these up, my girl. Now, we often see patients with X legs or parentheses legs. We are working to straighten their legs. However, rarely we do have patients who come to us wanting to thin their legs. Now, for the area above the knee, yes. Most patients are now aware that liposuction can be performed on the hips, front or inner thighs to thin the skin in that region. However, beneath the knee, most patients are not informed. I think we are leaving this area somewhat unaddressed. I mean regarding informative video preparation. Since we don't explain it thoroughly, there's not much information available. Patients are now reaching out to us with questions. Doctor, my leg below the knee is very thick, my calf is thick, my ankle is thick. What can be done? In any case, before making a decision regarding the treatment of this region, let us write 3 here. Before making the decision. My dear friends, it is essential to conduct an examination. Sometimes you patients are out of town. You ask, can we send a picture? If you have a thickness problem below the knee, no, it won't work. Because without examining, without observing the hardening of those muscles while you stand on your toes, we have moved to the leg, to the calf, and to the ankle, without seeing those muscles harden. I can't say if your foot, leg, or calf is thick or not. I can't say if we can slim it down. You will rise on your toes. The muscles will be like stone. Then I will check the thickness of the fat tissue between the muscle and skin. If the fat tissue thickness is excessive, then I will say to you, yes, you will benefit from leg thinning surgery. I am speaking generally about the liposuction method. I will inform you, you will gain from this surgery, dear patient. And then I will explain to you how the surgery will be performed. Now here, liposuction in the leg, calf or ankle differs from liposuction in other body parts. What's the difference? The overall reasoning and the general concept are identical. The uniqueness is here, dear friends. In this region, even in patients who have a thick layer of subcutaneous fat, when we compare it to other areas, the area is tight and the space is narrow. That's why when we perform surgery, that is, when we operate, we must utilize thinner cannulas with added care, and we must operate with increased caution. What I'm trying to say is that this area demands more seriousness from us. This is an area that requires us to take our work more seriously. Since the space is tight and if we do not work with precision and care, I'm sorry. If we fail to be more meticulous and careful, it can cause us problems in terms of results in this area. Therefore, we will be more meticulous and careful. We will opt for thinner cannulas and more refined methods. Just like we always do, this region demands a bit more delicacy and grace. For instance, if we are using a 4mm cannula in the abdominal region, the stick, or if we are using a 5mm cannula, we should not use that cannula in the ankle. We should perhaps use 2mm or maybe 3mm cannulas when performing liposuction in these areas. Concerning the drainage of the fluid that will collect in that area post-surgery, we will need to take some special precautions. When we do these, dear friends, we will have made progress towards better results. We will be mindful of these matters regardless of whether you wish it or not. Is it necessary for you to say this? No, it isn't. I'm just talking to provide you with some information. While working, I also want to keep you informed. We perform these surgeries under general anesthesia, dear friends. I mean the leg slimming surgeries. We perform them under general anesthesia. After removing the fat tissues from that area, we put a corset on you and wake you up. And we take you to your room. If the amount of fat we remove is substantial, we host some of our patients overnight at the hospital. If the amount of fat we took is small, and if the patient is compatible, we can discharge them on the same day. This depends a bit on your health status. We will assess this based on the procedure's intensity and your health condition. The procedure is done. You have been released. You were released either that day or the next. We will invite you for a follow-up in 2 to 3 days. During these checkups, we will assess your condition. If everything is fine, we will say, go ahead and start taking baths. We advise you to start bathing. We allow you to take a bath. You will use your corset for 3 weeks. During these 3 weeks, in calf, leg, and ankle slimming surgeries, the swelling caused by trauma and surgery will be somewhat exhausting for us in the early period. How will we manage the treatment? While sitting, we will place our foot on a stool or chair. We will lie back sometimes, pushing our foot against the wall, using gravity in reverse to help reduce our swelling and edema. We will help our body by speeding up the reduction of swelling. We will take mechanical measures. The leg will be in front. After 3 weeks, this swelling will announce its presence for about 10 days to 2 weeks. It will be a bit uncomfortable for you. It will require some effort from you. You will start to feel relief after that. We will see you again in 3 weeks. When we do, we will say, get rid of this corset now. There is a very slim chance we may extend corset use for another week. Typically, by the end of the 3rd week, we have released our patients from the corset. The surgery's full integration. When we look at the cellular level, you will start to see results that will make you happy within an average of 2 to 3 months. However, the completion of cellular level wound healing occurs at a scientifically microphobic level. The healing process typically lasts between about 9 months and 1 year. You won't see anything outside, but inside the cells are busy. They are working non-stop 24 hours a day, making the tissues compatible. They convert healing tissues into firmer and softer types of tissues. They know their job and keep going. They continue to work 24 hours a day for 9 months to 1 year. After 2 to 3 months, you will not notice much. And hopefully you will love us very much because we will achieve a wonderful result. Let's say you have such a problem, you have such a concern. My colleagues and I will work to create a solution to your problem with the best refined methods possible. We will continue to work on it. I hope this video was useful to you. If you liked it, please hit the like button. Please don't forget to follow our Esteport channel and recommend it nicely to your spouse and friends. Write your questions in the comments below the video. We will increase our interaction and we will be more beneficial to each other. This way, the video will reach those who have this issue. Take care, dear friends. Until next time. Let me be with my patient and myself for now. I'll get back to work. Hope to see you again. Goodbye.